Today is National Internal Medicine Day, celebrating the healthcare specialists really all across the country.
Channel 3's Caitlin Nuclo has more in this week's Wellness Wednesday report.
Well, it is National Internal Medicine Day, and Dr. Rebecca Andrews is here to talk about why you need one and how you can find the right one for you. Thanks for being here, Dr. Andrews.
My pleasure. Happy to be here this morning.
So take us through, why is it so important to have a GP, especially, nowadays where maybe you're feeling a little bit worried about going to the doctor?
Yeah, so I think the first thing I would say is general practitioner is a misnomer that we used to use. Now we try to specify what type of specialist. I'm super excited about general internal medicine and National Internal Medicine Day this year, because internal medicine has been on the front lines with the COVID-19 pandemic. We are the docs that you see for primary care, in the hospital, taking care of you, in your ICUs. One of the things I would say is really important to have a physician, especially now. We in internal medicine do everything from health to complex disease. I think a lot of patients right now are afraid to get out and go out and be seen. And so people who have chronic diseases might not have them as under control as previous. So having that long-term relationship with someone, especially right now because we can do video visits, is a great idea. We can keep you as healthy as possible during this time period, but also keep you safe.
Sure. So if you don't have one and you're thinking now's a good time to find one, where do you begin? What kind of questions should you be asking? What should you be looking for?
This is the number one question I get from friends and family. I think there are a few things. There are people who are really particular. They want a male or female physician. They want someone who's close to work, etc. I think one of the biggest things is location. If your doctor is 2 hours away, getting to see them can be a challenge. And that's okay if you're being seen once a year, but you want to be able to get in with your same internist when you have the flu or a cold, because it keeps all of your care in one spot. So I think easy access is important. Right now, we do have video visits. I don't know how long that will continue, but being able to get them to take care of chronic diseases is a best idea. Also, maybe cultural. If you maybe you're from a certain culture that you want someone to understand your background, your holidays, maybe your diet specifications, that's a great way to bond with someone. But mostly you just want someone that you can relax, talk to, feel heard, and trust. This is a long-term relationship over a bunch of years.
Really good advice. Thank you so much for being with us, Dr. Andrews.
My pleasure.